Do you think it was time to lift these restrictions?
I have hesitancy around lifting restrictions. We are very much still in the thick of this pandemic with the sixth wave. We know there's many cases of COVID. Unfortunately, we're seeing a rise in hospitalizations and people getting more sick with this illness. I worry that as we loosen these restrictions more and more, that we will have more spread.
And so we've seen these hospitalizations of kids, increase just over the last few days, if not the week. So why do you think they went ahead with this decision?
I think there's lots of public push towards moving back towards normalcy, and it was a huge headache for families to be testing their children pre-travel. And we had many calls from families to get notes saying that they were tested and they were safe to travel. So it was a big burden for families. But I worry that not only will kids be exposed to other people that are unvaccinated and could have COVID, of course, people could be vaccinated and have COVID as well. But in addition, they're putting other people at risk as well that may be vaccinated or have weakened immune systems.
Yeah, and this comes in on the heels of a report that was just out today, doctor, that says it does show the unvaccinated are more risky in terms of spread for even vaccinated people. It shows that they do have a higher level of spreading this disease. So what do you make of that?
I think as much as we can, we should be keeping the public health guidance that has kept many of us safe over these 2 years. Wear a mask for sure if you can. Of course, children less than 2 cannot wear masks, and these are unvaccinated children as well. Stay home if you're sick. Even if you have just a runny nose, it could still be COVID. And please do get vaccinated if you're eligible, and make sure you get boosters as well. There's a lot of people that have their 2 doses and never got a booster. Many people that are eligible for a second booster or 4th dose. And of course, many children that are eligible for vaccination, but their parents or they have chosen not to get it.
So what's your message to that group in particular, for those kids aged 5 and up who can get vaccinated but are choosing not to at this time because there are anecdotal reports that kids who get COVID aren't as sick?
While it's true that most kids stay very well with COVID and adults as well, we are seeing with these more virulent strains, potentially more illness. And with enough cases, we will see more children getting sick. It's just a numbers game. Right. Enough people get COVID, some will be children, some of these children will get very sick.
It is basic math. I'm almost out of time, but where do you see us, say, a month from now or 2 months from now, when we do enter the summer months and people are outdoors more, less indoor, contact? Will we see a decrease at that point?
I certainly hope so. As long as we have close contact with one another, if we're not wearing masks, if we're not staying home, if we're sick, if we're unvaccinated, we can pass it along more easily. Outdoors, hopefully this will lessen the spread.
Is there a likely chance of another variant emerging as we head into fall, Dr. Kulik?
I think we're at risk of that. As long as we have more people getting COVID, that's a lot of petri dishes for this virus having a chance to mutate. We keep numbers lower, we will prevent further mutations.
The message really hasn't changed, has it?
It really hasn't, but a lot of people feel like this is over, the pandemic is gone, and we can live our lives again, and that's not quite the case from my perspective.
Okay, I appreciate your insight this morning. Thank you, Dr. Dina Kulik, pediatrician and founder of Kid Crew Medical.